Good afternoon and welcome. My name is Robin Wansley, and I am the chair of the Administration and Enterprise Oversight Committee. I am going to call to order our scheduled meeting for today for March 17, 2025. Before we begin the meeting, I want to offer a friendly reminder to all committee members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. And with that said, I will now have the clerk call the roll.
Councilmember Vita.
Present.
Ellison.
Here.
Cashman is absent. Chugtai.
Present.
Vice Chair Palmisano.
Present.
And Chair Wansley.
Present.
There are 5 members present.
Let the record reflect that we do have a quorum. I will also remind my colleagues that we will be using speaker management today, so please make sure to sign in or let the clerks know if you need some assistance with that. Before we move on to our published agenda, I am proposing an addition to the agenda to receive a briefing on strategy for labor negotiations involving the Police Officers Federation in closed session. With that said, is there any discussion on this amendment to the agenda? None? Okay, great. I will actually do a voice vote. All those in favor say aye. Aye. Those not in favor, all right, the ayes have it, and that motion carries. There are 19 items on the consent agenda, which I'll now read for the public record. The first is a gift acceptance for travel and lodging from Every Town for Gun Safety Support Fund. Number 2 is a gift acceptance from the Carbon Neutral Cities Alliance of registration, lodging, and airfare. 3 is a gift acceptance from the Big Cities Health Coalition of lodging, travel expenses, and meals. 4 is a gift acceptance from the National League of Cities for travel, lodging, and meal expenses. 5 is a gift acceptance from the National Public Safety Partnership for travel and lodging expenses. 5 is a gift acceptance from the Link for tickets to the Link Elevate and Empower Gala. 7 is a bid for Minneapolis Public Works water utility supplies. 8 is a bid for Green Storm Water Infrastructure Restoration Project. 9 is a bid for circular corrugated trench shields. 10 is a contract with Downtown Minneapolis Transportation Management Organization, such as Move Minneapolis for ABC Ramps multimodal outreach programs. 11 is a contract amendment with Restoration and Construction Services, LLC, for the Pioneers and Soldiers Memorial Cemetery Masonry Pier Repair Project. 12 is contracts for 2025 and 2028 customized safety training and training services vendor pool. 13 is a contract with Metro Blooms Design and Build, LLC, for private property tree planting. 14 is a contract with Tool for Labor Standards and Claims Navigator Services. 15 is a lease amendment with 2700 East 28th Street, LLC, for the Fire Department Employee Assistance Program office space. 16 is a collective bargaining agreement, Minneapolis Building Inspectors 2025 through 2027. Number 17 is a collective bargaining agreement, International Brotherhood of Electrical Workers, Local number 292, Electricians, for 2025 through 2027. 18 is legal settlement workers' compensation claim of Shane Thorne. Number 19 is a legal settlement workers' compensation claim of Melissa Roger. So with that said, I will move all items for approval and also open it up for discussion. I do see Councilmember Vita in queue.
Thank you, Chair Wansley. Item number 6, I need to add my name to this list also for the gift acceptance. I don't know if I need to just bring an amendment forward for full council or if we could do that now for the gala tickets.
Yes, I would recommend you bringing a walk-on RCA for full council.
A walk-on RCA?
Yes.
Okay.
Yeah. And the clerks can, of course, like work with you on that. Since we can't make amendments right now in real time without the proper RCA paperwork submitted.
I don't need an RCA, though. I just need to amend it to include my name to the exact same thing.
Is
A RCA would be a completely separate action.
for the gala, is this for a council member? So
It's for me.
yes, so I think our individual offices, my office had to submit an individual RCA. I don't know if they just grouped all of ours together under this, but I can also ask the clerks to specify a little bit more.
Madam Chair, all of them were submitted under one RCA. I believe we could just add Councilmember Vita.
Right now, real time?
Right? Does that sound right? We'll work with your office like after the meeting.
Thank you.
Okay.
Yep.
So again, we'll figure this out before full council.
Yep.
Thank you. So that said, I will move all items for approval. All those in favor say aye. Aye. Those not in favor say nay. All right.
Chair,
Sorry, yes.
just wanted to recognize my attendance.
Oh, yes. I also want to recognize that Council Member Katie has joined us, and you have been recorded as affirmative on all those items on the consent agenda. So that said, we are now moving on to our discussion agenda. First, we will have a discussion item related to the contract with Cornerstone Advocacy Services for Sexual Assault Victims Advocacy Services. I will ask Deputy Chief Emily Olson to come up and speak on this item.
Chair Wansley,
Hi, welcome, Chief.
this is the first time I've addressed the council, so if I do it incorrectly, give me some grace. So, Chair Wansley and chair members, I'm coming just to talk a little bit about the advocates. These are just to make me look smarter. It's not my age. We have a sexual assault advocate that is embedded in the sex crimes unit. I actually was the sex crimes lieutenant when we originally had this advocacy in the unit. They assist us in a number of ways, and I believe that they are invaluable. They have a number on our teal sex violence resource cards that we provide to each and every survivor on scenes so that they can call for information and resources. They make confidential calls to victims so they cannot be subpoenaed to provide testimony protecting our survivor. The advocate will make calls when a case cannot be investigated or charged to assist with resources. They can connect with therapy, housing, phones, clothing, and other resources that might be needed. The advocate can meet with the survivor at the hospital for support and assisting with a SARS exam that can be incredibly invasive. The advocate also provides ongoing support during an investigation that can include fieldwork and interview support whenever an investigator may need assistance. And the advocate coordinates with the Hennepin County Attorney's Office to ensure a smooth transition when the case is charged, and submits, the county advocate can get involved with the prosecution at the end. So then the advocacy changes over to the county. So basically, they hold that survivor's hand to the very end. I did bring a few numbers just so that you understand the magnitude of what they do. Last year in 2024, the sex crimes unit handled 910 cases. And in the sex crimes unit, it is required that we call each and every victim in every single case. And the advocate helps with all of those phone calls. If we feel that it needs a gentler phone call, we'll ask the advocate to either be present or to make that call. And so they are just absolutely, I don't know what we'd do without them. And so far, as of the 13th of March in 2025, we've had 128 sex crimes cases. So just wanted to plug the amazing work that they do. We really don't know what we would do without them.
Thank you so much, Deputy Chief Alston. I also asked for a brief overview of this item. I think this is one of the items that we get to highlight where the city is actually doing really good work in supporting critical population such as those who unfortunately have had to go through the experience of sexual assault or any level of sexual violence, and knowing that there are resources here available as they move through a formal, traditional, or justice process. So thank you for sharing that information. I will look to see if there's anyone in queue for any questions. I don't see any. So with that, I will motion for approval for this item, and we can just do a voice vote. So all those in favor say aye. Aye. Those opposed say nay. All right, the ayes have it, and that motion carries. Thank you so much,
Thank you for your
Deputy
time.
Director. Next item, 21 on the discussion part of our agenda, we will have an update from the Racial Equity, Inclusion, and Belonging Department. So I will ask Director Corbett to come up and present for us.
Thank you, Chair Wansley and committee members. Prince Corbett, Director of the Racial Equity, Inclusion, and Belonging Department. And today just going to provide, as part of our quarterly update, some learning and development opportunities that we are working to cascade down throughout the organization as it connects to metamorphosis. So I always start these off as a level setting and ground setting around expectations of the Racial Equity, Inclusion, and Department, which was established in 2022. And then our work and responsibilities are guided by Chapter 21 of the Minneapolis City Ordinance. The ordinance establishes the duties of the REIB Department, the responsibilities of other departments in the city, and provides definition for equity, racial equity. And equity is having outcomes for all people based upon fair and just opportunities, whereas racial equity specifically is the development of policies, practices, strategic investments to reverse racial disparity trends, eliminate institutional racism, and ensure that outcomes and opportunities for all are no longer predictable by race. Focusing on the duties of the department as outlined in the ordinance provides guidance as to what is in scope of the department, and there are two overarching duties. One is developing and adapting a racial equity framework, and then coordinating and supporting efforts by all departments within the city of Minneapolis. Both of these overarching duties are about guiding and supporting departments and employees in the city of Minneapolis. Coordinating and supporting efforts by all departments focuses on ensuring that racial equity is in everything that the city does. It involves organizing and facilitating collaboration between different city departments to work on racial equity. It means providing resources, tools, and guidance to departments to help them achieve racial equity. This means considering racial equity when developing budgets, designing public spaces, and providing services, along with a whole lot more. And stated here on the slide deck is just for a few of the dozen strategies that REIB can employ in order to advance racial equity throughout the city of Minneapolis. Today's update will focus on C, which is working with our HR department in designing and ensuring that the city offers a broad-based training and capacity-building curriculum. Racial equity learning and development sessions play a vital role in building the enterprise's capacity to advance racial equity by equipping staff and leadership with the knowledge, tools, and skills needed to identify and address racial disparities, biases, and systemic inequities. Racial equity learning and development offers tools and frameworks that staff can apply directly to their work. These tools can help staff identify where inequities exist and how to create more inclusive and equitable practices. Racial equity learning and conversations about race and racism, which is often an obstacle to advancing racial equity. And so for today, I will just be providing an overview of some of the racial equity learning and development sessions that we are preparing for city employees based on some of the models and learning concepts that were shared with senior leadership as a part of the Metamorphosis program. So the Metamorphosis Leadership Development Program is a 7-month program that was offered in 2022, as well as in 2023 and 2024, to all of the directors and their direct reports. The program was facilitated by Good Works Consulting, and some of the learning objectives of the program is understanding how racism operates systemically, increasing non-judgmental awareness of whiteness as a default. It shows up in how it prevents systems and broader humanity from achieving equity, identifying the behaviors of an anti-racist leader, and then using anti-racism lens to assess, understand, and improve the experience of employees, and recognizing the overlapping and interdependent systems of discrimination. Through this journey, senior leaders examine their mindsets, which allow them to reflect on how we perpetrate systems that hinder equity while learning new leadership behaviors that challenged us to consider how we change systems by co-creation of inclusive practices within the city. Transforming behaviors to achieve racial equity can have a profound impact on individuals, organizations, and society at large. Behavioral transformation refers to intentional, sustained change in attitudes, actions, and practices that contribute to dismantling racism and promoting fairness. This transformation isn't just about addressing discriminatory actions, but also about reshaping the systemic structures and personal mindsets that perpetrate racial inequities. The butterfly visual illustrates 4 fundamental types of actionable leadership behaviors. Real change occurs when leaders authentically transform their behaviors of leading and decision-making, and adapting new behaviors enables us to display any lingering guilt, fear, and defensiveness, guiding us to align our intentions with explicit actions. In a pre-assessment of Metamorphosis participants, leaders identified 2 behaviors that are less frequently embraced within the city, which is confronting thoughtfully and immediately, and seizing every opportunity to repair harm. Confronting thoughtfully and immediately is being able to openly talk about race, racism, and opportunities for systems-level change, to rectify racism, and as a result, willingly engaging in direct, timely, thoughtful confrontation, i.e. creative conflict, with an intent to create positive change. Seizing every opportunity to repair harm is learning to place reconciliation, reparation, and racial healing at the center of our thought processes. This includes leading and equipping leaders to lead these efforts to reconcile harm that has been committed in the system by dedicating time, space, and resources to truthfully accounting for an individual's experiences. Systems change refers to the process of altering the structures, policies, practices, and norms that shape how a system functions. In the context of racial equity, systems change works to address and dismantle the underlying structures that perpetrate racial disparities and injustices, and rather than focusing solely on individual behaviors or isolated incidences of racism, systems change seek to reform the broader systems that disproportionately affect marginalized racial groups. And this image before you is a representation of 4 different systems at the self, social, organizational, and societal, along with the associated components, and then recognizing that racism can exist within each of these systems, and conducting an in-depth racial equity assessment of these systems will help identify if inequities exist in policies, practices, and resource flows. This type of critical assessment can help address the root causes of disparities, transform policies and practices, as well as shift power dynamics. The result is a more equitable society where all individuals, regardless of race, can thrive and have equal access to opportunities and resources. So laying that as a foundation for what it is that we actually will be doing. So in order to help build the knowledge, skills, and abilities of Metamorphosis attendees in transforming behaviors and systems change, Good Works Consulting introduced the repair harm model, the thoughtful confrontation model, as well as a race equity impact assessment. We felt it is important that this learning should not just be shared at the senior leadership level of directors and their direct reports, but there is a need to support the skill building capacity of the entire enterprise and understanding the repair harm model, the thoughtful confrontation model, as well as doing a deeper dive into the racial equity impact assessment. The learning content for transforming behaviors will include awareness, education, self-reflection, and actionable steps to enhance employee skills in the areas of confronting thoughtfully and immediately, and seizing every opportunity to repair harm. The systems change learning on the racial equity impact assessment will enhance employees' ability to analyze data and results, addressing emerging tensions, and apply insights learned to enhance departmental outcomes and outputs. Now, I would like to provide you with an overview of these models and share with you some of the learning contents as well as a very high-level timeline of implementation. So the thoughtful confrontation model was created to build skills around confronting thoughtfully and immediately. It involves clearly stating the problem, co-creating the solution, and thinking about our being culturally responsive in our responses, calling in versus calling out, and then calling in people is calling people into the conversation of when harm has been done, of like calling people in and inviting people in to have a conversation, rather than calling out is almost like pointing and blaming a little bit more. And then confronting and settling down and being able to come together to create a solution towards the issue where all parties have something that is meaningful for them. The repair harm model, also known as the truth and reconciliation process, is a simple four-step process of truth-telling, seeking to understand, remediate, and then follow up and follow through. The process is not linear, so I always state that in that there could be a situation where we start off with truth-telling, then we go to seek to understand, and then have to come back because in seeking to understand there may be some truths or new truths that we find. And then finally, with the equity impact assessment process, this involves determining outcomes and interested parties, aka stakeholders, examining the numbers and narratives, measuring the burdens and benefits, and evaluating and holding ourselves accountable. In determining outcomes, we analyze who are the key racialized groups impacted by a policy, practice, process, or decision, and examine ways to bring those voices of the impacted groups into the decision-making process. When we examine the data that has been collected to determine if there are racial disparities while learning from histories and narratives to better understand the data, we are examining the numbers and narratives. Measuring benefits and burdens allows us to explore if some communities will be harmed by a decision and explore other alternatives to cease potential harm. Identifying methods and measuring impact and mapping out a continuous process improvement approach helps us to evaluate and be more accountable. Now, with each of these models, there will be a learning content, and this is what the learning content includes. It includes a readiness assessment, so for the thoughtful confrontation and repair harm model, a questionnaire for the department or leaders to self-assess where they're starting at. There will be asynchronous e-learning content, so we're taking the models or the steps from those two models, the thoughtful confrontation and the repair harm model, and developing multimedia e-learning that will be available for employees. We're working with GoodWorks to develop workshop facilitation materials, which includes a facilitator's guide, visualized materials, and other relevant learnings that is needed. We're looking at developing a at-a-glance guide, so this will be a quick reference guide for city employees to look at the repair harm model, thoughtful confrontation model, and how they can utilize those within their teams across the organization with different projects and initiatives that are going on. And then the meeting in the box is a templated agenda. So this will be the meeting in a box where a leader can be able to pull out kind of various different tools if they want to lead a discussion within their own teams about thoughtful confrontation, repair harm, and the race equity impact assessment. And then finally, a learning assessment survey, because we do want to gather folks' attendees' feedback and work on how do we improve some of the learning content that is available. And then finally, we have a train the trainer component, and this will be, we are this week working on recruiting individuals and leaders across the organization for a comprehensive training to be trained the trainers for these three models. So with this, we will be providing 3 2-hour sessions for individual employees who would like to be able to be trainers like for these models, because once the training is developed, then we need the staffing capacity to be able to share out, to be able to do trainings for other individuals as well. And at a high level timeline, we're already in quarter one. So one of the things with the racial equity impact assessment, the reason why it's not fully fleshed out, because we are currently working on customizing the content with GoodWorks. So all of the content that we have will be customized, and we're working on getting that customized. We will be later this week doing the internal stakeholder engagement, reaching out to department directors, folks who completed metamorphosis, asking them who are the leaders and other people from their department who they would like to nominate or recommend to be a part of the Train the Trainer. And then looking at cascading down and starting rolling out the Train the Trainer sessions in quarter 3, 2025. And more than likely it'll be ahead of time, but this is anticipated timeline. And then looking at a department by department or enterprise rollout by the end of 2025. So just wanted to provide this quick overview of some of the body of work that we're working on and how to take some of the learning that was learned at Metamorphosis at a high level and being able to share it down within the organization so that leaders and employees at all levels of the organization are speaking the same language, knowing the same models and frameworks. Thank you.
Thank you, Director Corbett, for that presentation. I will see if I put myself in queue, but I want to make sure if there's any other folks. Okay. So first, just going back to slide number 12, actually, more interested in steps 3 and 4, in terms of how you develop metrics of success to evaluate the effectiveness of the metamorphosis training, what those outcomes were. I know you're giving kind of the second phase of that post-metamorphosis with the initial trainings for staff, but just wanted to get a sense of how did we determine that to be successful?
The metamorphosis program? Mm-hmm. If I'm not mistaken, I believe that there's going to be another presentation coming up about all of the metamorphosis outcomes. So this specific is in regards to a racial equity impact assessment and how to measure the benefits and burdens like of a policy, practice, budget, or decision.
Okay, and this is my first time hearing about a metamorphosis training for all things, but wanted to see if you all even had individual like metrics of success. We've had an ongoing conversation in this committee around just evaluation and program evaluations. So one, to get a sense of like what are those metrics that you determine to be successful based off of the support of this training?
And for clarity, are you talking metrics for our department or metrics specific for the training?
So I'm assuming the metamorphosis training was for staff, correct?
Yep.
And you all brought those in or Metamorphosis as a vendor to provide that training to said staff, right?
Yes. What we're working on is the training specific for the repair harm model, thoughtful confrontation model, and then the race equity impact assessment.
And again, the expected outcomes from
Yep.
that. So that's what I'm asking in terms of like metric success or outcomes that you determine will be
Okay.
effective.
Yeah, we're in the process of building those out. So we just started the contract and work with GoodWorks around it. So part of the metrics is number of attendees or number of city employees who attend the training, looking at the post survey and getting individuals' feedback around the training and was it effective and impactful. And then with outcomes, it's around organizational, cultural, and organizational change behavior, which sometimes is a little bit difficult to measure, but looking at how were we utilizing the My Minneapolis survey results year over year to determine like, is this training helping to impact some of like the racial equity questions within the My Minneapolis survey?
Okay, is that the one that's being rolled out by the Human Resource Department?
Yes.
Okay, so just even thinking of that, because I know when we received a presentation from HR, they talked about some of those dynamics of culture and breaking that down by, racialized experiences and seeing if there's things in that too, again, like if there's metrics that you're looking to evaluate even from that survey of like a shift, or is it participation of trainings or,
And there's participation in trainings, and then I will say also with some of the, like with the My Minneapolis survey, because the organizational change and behavior change that's going to happen is going to be like, takes years in order to get to and actually see the momentum grow. But looking at like with this training and some other things along with HR, it's almost like a piece of a pie with the culture change, and like the training that we're doing is like one small piece of the stuff that we're doing with HR or that HR is doing. Okay. Does that answer it?
Somewhat, yeah. Are you all going to be working with the Office of Performance and Management at all around some of that ongoing evaluation
Yep.
that I know they're going to be doing in the next year? Okay. Next question related to actually the truth and repair harm model. I know that has been a focal point in terms of how you're guiding somewhat the truth and reconciliation work that you all have been doing in the department. And I know you all, with even this presentation, have shifted to a more internal focus in providing services. So I guess I would like to get a sense of what does that mean for the external work around truth and reconciliation, if basically you all are just shifting into an internal phase for the foreseeable future.
Yeah, I would say for Chair Wansley, for the truth and reconciliation work, well, starting off, for me, it's not shifting, it's getting us into alignment of what it is that we're supposed to be doing with our duties and responsibilities, which is really internal facing. And specific for truth and reconciliation on the next quarterly update, do want to provide an update around the work that we are doing with StoryCorps around truth, healing, and reconciliation, to be able to share kind of external community facing what that looks like.
Okay. And then also going to the racial equity impact analysis, Rhea, just thinking of, I know you're focusing on HR, but even HR has to complete REAs and things of that nature. And this is where I'm trying to get a sense of the metrics of defining success and how we can start to track that in a more granular phase. So we've had this long conversation around in the legislative process, what would it look like to update that REA and to modernize it and improve it. So just trying to get a sense if any of this work will also lead to potentially updating this critical part for departments to have to say, okay, this is how we're approaching this item we're submitting for consideration by council, and the racial equity analysis we did on the item.
Yes, Chair Wansley, thank you for that. I'm in full agreement because the REA and the current RCA process is probably about a decade old from when it was first started. And then with this equity impact assessment, it's we're taking and figuring out the questions in our current REA and how to blend that into the equity impact assessment that Good Works has, along with some of our own city's definitions around race and racial equity. So that customization of it. So the equity impact assessment that Good Works has is a lot more detailed than the city of Minneapolis's current REA. And the thought process is that if a person is trained on a more comprehensive race equity impact assessment from another organization, they should be able to complete the city of Minneapolis's current race equity impact assessment to get to more actionable items and results, if that makes sense a little bit. So, and we're working on blending the customization of the race equity impact with Good Work so that it connects to some of the concepts and definitions that we have within the city of Minneapolis, the operational policy priorities of the SREAP, et cetera. So that assessment will be kept tethered and connected to other racial equity initiatives.
Okay. And then just my last question, just knowing that we have had lots of conversation around interconnectedness around other identities within racial equity in terms of gender, sexuality. I know budget amendments moved a lot of that work out of REIB, so I just want to get a sense of, is that work primarily going to be taken up by NCR now, or how will you be relaying that type of interconnected analysis around those different identities in this particular work?
Thank you, Chair Wansley. So with the equity impact assessment or race equity impact assessment, there is, there is a piece around other people's identities and intersectionalities. So not just, we're leading with race, but not leaving out people's other intersectionalities. So when individuals are doing an actual thorough equity impact assessment, they will be asked to consider other people's other self-ascribed identities.
Okay. I think definitely in the next quarterly update, we'd love to hear a little bit more even about this piece of where you all are at. I know you mentioned it's kicking off in Q1, and it's starting a little bit behind, but I do see Council Vice President Chuck Ty in queue. So thanks for answering my questions.
Thank you, Madam Chair. Thank you for this presentation. I know in a previous quarterly update, you mentioned as well that there's some work underway to just reevaluate the RIAs and potentially update those or provide additional training. I'm wondering if this work is including or is in consultation with, collaboration with, anything of that sort, our clerk's office, as the purpose of RIA, which is embedded into our request for council action, committee action. Its purpose is to inform the public and decision makers about the impact, the racial equity impact of an action that's before us. So just wondering if you're talking with the clerk's office.
Chair Wansley, Council Vice President Chuck Ty, we will be talking to the clerk's office. And then in addition, for Metamorphosis, all department directors and their direct reports, and the clerk's office was invited to attend Metamorphosis. So within Metamorphosis, there was a section, specifically a learning lesson around the equity impact assessment that Good Work shared. So that was offered to whoever attended Metamorphosis from the clerk's office with respect to that. With respects to the city's racial equity impact, or the city's RIA, we are working on prototyping, so to speak, a updated RIA in a sense, as well as a race equity budgeting tool. And we're developing the process, and that's one of the things, one of the items for our department next is to actually do that engagement with the clerk's office to find out what's beneficial, what's not beneficial with the current RIA, and actually engage the clerk's office and other employees who utilize the RIA.
Got it. I just wanted to make you aware that, and the reason I asked the question is there is work underway right now within the legislative department to reassess, like a checklist for whether RCA is completed thoroughly or properly, whether RIAs are being completed in a manner that allows for anyone that's reading them, whether that is a council member about to take action on the item before them, or a member of the public that's trying to determine whether an action is beneficial to them. That work is happening right now. And so, I will continue to encourage and urge that you engage with the legislative department and the clerk's office as that's work that I am aware is underway right now as well. Just shifting gears, I'm curious if you can speak to, and this doesn't have to be a precise number, but if you can give me a ballpark on how many enterprise leaders have completed training on the repair harm model and the thoughtful confrontation model.
Chair Wansley, Council Vice President Chuck Ty, I do not have that data, but once again, I know that I think within the next month there will be a more formal presentation specifically about Metamorphosis, and so I will communicate that because it probably might be in that presentation.
Got it. Yeah, I think something I'm just curious about. My understanding is it's like all department leaders and then additional leaders within departments as well that have to date completed the training in both of these models. And I was just curious if you could speak to whether you've seen either of these models be used, put in action so far since the completion of this training, or?
Yes. Council or Chair Wansley, Vice President Chuck Ty. With respect to the repair harm model, this was utilized. And I'm thinking about how to communicate this while maintaining a level of confidentiality. So there was a situation in which someone had made some public comments that really harmed certain groups of people. And the comments initially weren't serious. There was a person who kind of made a joke about something, and then it came back that a lot of people were harmed by the comments. And I ended up having a sit-down consultation with that employee, and we went over the repair harm model around truth-telling, like what is the truth that they wanted to convey, like when they made the comments, and we talked through that. Seeking to understand, which is the individuals that were harmed by the comments, primarily racialized people, individuals with disabilities, individuals identifying as LGBTQ, around what their perspective was about the situation. And then remediate was after hearing and understanding, this employee called together all of the employees that were impacted by the comments that were made to be able to actually seek to understand and then listen through feedback around what their concerns were. And then the follow up and follow through is that they made certain promises to the groups of employees around rumors of things that may have changed and just setting the record straight around any misconception. So being able to sit down and actually kind of do this, but we also, to that point, working with Good Works, one of the things that we realize is needing more case studies around the models, because there's a lot of theory and then actually how to turn theory into like actual practice. So looking at there's some sample case studies, but through the training, we want to be able to work with employees to figure out how they are utilizing like this model specifically. And I could even share in a one-on-one instance with an employee who, where I had to sit down and repair some harm, like with an employee that was, with an employee that I had met with. And it was really sitting down, truth-telling and stating like my perspective and also hearing their perspective from what the situation was, being able to, in that meeting and conversation, just being able to come to terms with me understanding their truth, them understanding my truth, and then we was able to work together on like what is the resolve of the situation. So I've seen it beneficial in one-on-one settings as well as larger group settings.
Thank you, that's all.
Thank you, Council Vice President. I don't see any further questions in, actually, no, sorry. I did actually want, because you mentioned multiple times now that there would be a updated presentation on the metamorphosis piece, and I wanted to see if Deputy Director, if Sir Ray was here, or anyone from the executive. Thank you.
Good afternoon, Chair Wensley. Saray Garnett speaking, DCO.
Yes, DC. Can you share a little, if you know anything about this presentation? I will name, I don't believe we've been in coordination around it, but maybe you have some information that I know in terms of where that presentation would be likely given in the timeline.
I believe it's April 19th. I could be wrong, but it is April 19th. Planning for about 10 to 15 minutes.
Okay, and that will be coming from OPS then?
OPS.
Okay, good to know. Okay, thank you. Awesome. That's all the questions that I've had. Clerks, I will ask if you can receive and file that report. Next, we will have a discussion on item number 2022. This item is related to the contract with Cure Violence Global for the 2025 Minneapolis Strategic Outreach Initiative Technical Assistance Provider Services. So I will ask Deputy Director Lakes for them to come up and get their presentation up for us.
Thank you. Chair Wansley, council members, my name is Leah Lakes. I'm with the Neighborhood Safety Department, and I'm going to present today about the process for the Cure Violence Global Technical Advisor Request for Proposal, the RFP process. The primary objective of this RFP was to find an organization to provide technical assistance to the Neighborhood Safety Department to implement the Cure Violence model in our Minneapolis strategic outreach violence prevention work. The technical provider chosen from this RFP would provide technical support, including a comprehensive guidance on establishing robust data collection systems, and also support the development of training protocols for violence interrupters. They would also provide guidance on establishing a community-focused approach, including supporting organizations in delivery of effective violence interruption strategies and identifying high-risk neighborhoods and making sure our strategies are data-driven. They would also support sustainable program development, including creating an evidence-based intervention framework, building capacity for long-term program sustainability, and establishing metrics for program evaluation. This technical assistance would be critical in ensuring the successful implementation of the Cure Violence model in our Minneapolis strategic outreach violence interruption work and allowing us to create lasting positive change in our communities. The Cure Violence model is a groundbreaking approach in violence prevention. This model addresses violence through a public health lens, treating it as an infectious disease that spreads through community interactions. This innovative approach has transformed how we understand and address violence in urban settings. The model operates on 3 key principles. First, it identifies and works with high-risk individuals who may be transmitters of violent behavior. Second, it emphasizes early intervention to prevent violence incidents before they occur. And third, it focuses on stopping the further spread of violence within communities. What makes this model particularly effective is its relationship-based approach. Unlike traditional emergency response systems, our community violence interrupters operate through established relationships and trust networks. Their effectiveness comes from their deep connections within the community and their ability to identify and respond to potential violence based on various information sources they've cultivated. Since its initial pilot in Chicago in 2008, this model has demonstrated significant success across the United States and internationally. It has proven adaptable to various forms of violence, from gang-related incidents to domestic violence to school safety concerns. It is critical to implement the Cure Violence model in our violence interruption initiatives, as it is data-driven and an approach for neighborhood safety and violence prevention. For Minneapolis residents to live safely and thrive, we must address violence at its core. The Cure Violence model offers a structured, measurable approach that has shown significant results to reduce shootings and killings in communities across the country. By implementing this model, we demonstrate our commitment not just to responding to violence, but to prevent it through proven, data-driven methods that can create lasting, positive changes in our communities. The Cure Violence model's remarkable effectiveness has been proven across diverse communities worldwide. The approach has been rigorously evaluated through comprehensive assessment and extensively documented in more than a dozen studies and reports. The statistics you see here on this slide aren't just numbers, but they also represent the lives that have been saved and the communities that have been transformed. By implementing Cure Violence Global's approach in Minneapolis, we are positioning ourselves to achieve similar transformation in our own communities. The critical guidelines for requirements for getting a sole source waiver is something I want to talk a little bit about, because neighborhood safety originally applied for a sole source waiver for this application. The requirements for approving a single source waiver are outlined by procurement, and they are detailed out to ensure that we maintain the highest standards of procurement integrity and fiscal responsibility. There is a difference between single source and sole source waivers. A single source means that only one supplier is responsible or is reasonably available after a thorough search. And a sole source indicates only one supplier is capable of providing the required service due to unique circumstances. Key parameters for this include purchases that are above $5,000 but not exceeding $175,000. It requires thorough documentation and justification, and it must demonstrate reasonable effort to identify potential suppliers. It's critical to understand what does not constitute valid justification for a single source, which is personal or agency preference for a specific vendor, perception of a vendor as best qualified without competitive evaluation, and poor planning resulting in insufficient time for competitive bidding. The single source waiver process demands rigorous scrutiny and documentation to ensure we maintain transparency and fairness in our procurement processes while making use of best public resources. Our current partnership with Cure Violence started as a sole source contract from when neighborhood safety was a part of the health department as a part of the Office of Violence Prevention. Our current contract with Cure Violence Global is approaching its expiration in March of 2025. The Neighborhood Safety Department has submitted a sole source waiver application to continue receiving technical assistance and training from Cure Violence Global. The proposed sole source waiver produced contract, if approved, would have commenced on June 1st, 2024, and extended through June 31st, 2026. This continuation of services would ensure uninterrupted support from our violence prevention initiatives and maintain the momentum we've built in our community safety efforts. While procurement denied the sole source waiver due to the purchase dollar limit being over $175,000, we remained committed to securing appropriate technical assistance to support our violence prevention efforts and began compiling an RFP process to identify a vendor to provide us with technical assistance on the Cure Violence model. NSD staff wrote the requirements into the RFP to align with the city's goals and community needs. We also included clear and transparent proposal requirements. Our RFP included detailed instructions and expectations, given all potential responders equal access to information and opportunity. We also outlined our review process in the RFP with clear evaluation criteria to ensure unbiased assessment of all proposals. We have maintained the highest level of integrity with our process, and we've also collaborated with the procurement department to make sure that their guidance has assured that the process was fair and transparent. Additionally, the city attorney's office has provided crucial support for ensuring our RFP complies with both city and federal requirements. Their oversight has helped guarantee that our contracting process meets all legal standards and protects the interest of our community. The structure of our RFP demonstrates our dedication to fostering fair competition while maintaining service delivery is held to the highest standards. Before release, The RFP was reviewed by the Permanent Review Committee, which consists of a diverse panel of experts who review the RFP for compliance in their areas of expertise and ensure the RFP follows procurement policies, federal and state laws, and other directives and mandates. To attract qualified potential responders, we conducted an extensive outreach effort as a part of the RFP process. GovDelivery notifications were distributed to over 7,000 subscribers, ensuring broad awareness of our RFP. Through our e-supplier platform, we reached over 700 potential bidders and suppliers. The current incumbent vendor was also directly notified of the opportunity, and our internal and external partners, as well as previous vendors were notified of the opportunity via email by NSD staff. This comprehensive outreach approach demonstrated our commitment to inclusive procurement practices and ensured all qualified organizations had the opportunity to participate. Under the Cure Violence model, organizations who are selected for violence interrupter work will receive comprehensive training on key components of the Cure Violence model: detecting and intervening in potential violent situations, working with high-risk individuals who challenge their behavior, and engaging in community to shift norms supporting anti-violence practices. The selected vendor will offer continuous guidance through workshops, coaching, and on-the-ground support to ensure that organizations implement evidence-based strategies effective to their communities. The RFP was designed to identify the most qualified vendors to provide this support and technical guidance. To ensure we maintain the highest standards of service delivery, all respondents must meet the following minimum qualifications. They must be a Minnesota business and be registered as one, and they have to fall into one of the categories of either an IRS-designated 501c3 nonprofit organization, a neighborhood organization, cultural organization, or places of worship or faith-based organization. Respondents must also demonstrate a proven track record of providing technical assistance to violence interrupter staff and partners specifically using the Cure Violence model. They also must not be listed in the federal or Minnesota State Department list, and they must be in good standing with the Minnesota Secretary of State. Our evaluation process for those who applied to this RFP was to use a 100-point scoring system across 3 key areas. Qualifications and experience were worth 40 points. Project understanding and approach was worth 30 points, and the cost proposal was worth 30 points. This structured evaluation approach helped us identify the most qualified vendor to support our violence prevention initiatives. I'm pleased to announce that following a rigorous RFP process, Cure Violence Global has been selected to provide technical assistance for our Violence Interrupter initiative, which follows the Cure Violence model. The selection process was thorough and competitive, with Cure Violence Global demonstrating exceptional expertise and capability across all evaluation criteria. Their proposal demonstrated several critical areas where they would support us, including staffing schedule hours and worked advising, which includes the development of optimal staffing patterns for violence interruption work, guidelines for shift coverage in high-risk areas, strategies for managing staff schedules in a crisis response. They also provide staff performance accountability, including implementation of clear performance metrics and training, development of staff evaluation frameworks, and creation of accountability systems that align with program goals. They also demonstrated their ability to support program monitoring and reporting, including the establishment of comprehensive data collection tools and protocols, design of regular reporting mechanisms, and implementation of quality assurance measures. In addition, they demonstrated their ability to provide program outcome evaluation support, including the development of measurable success indicators, the creation of impact assessment tools, and the implementation of continuous improvement processes. Their expertise in implementing the Cure Violence model, combined with their proven track record in technical assistance, positions them to provide comprehensive and quality support for our city's violence prevention efforts. I would like to highlight the sophisticated data management system developed and maintained by Cure Violence Global. Their comprehensive database system represents 15 years of refined documentation tools and techniques specifically designed for violence prevention outreach work following the Cure Violence model. This secure, web-based system encompasses several critical components. It provides comprehensive data collection, including outreach, participation tracking, case management, documentation, community activity records, violent incident monitoring, community mobilization efforts, public education initiatives, and conflict mediation tracking. Cure Violence Global provides robust training and support, including thorough database training for all key personnel, including the violence interrupters, outreach workers, site supervisors, program managers, and city staff who are overseeing this project. The service package provided by Cure Violence Global includes comprehensive support, including regular data analysis and reporting, scheduled check-in calls, ongoing system maintenance, and real-time monitoring dashboards. The Cure Violence Global robust data management system ensures transparency, accountability, the ability to communicate well, and continuous improvement in our violence prevention effort. The data entered by violence interrupters will be used to create performance monitoring dashboards. Here you see an example of a dashboard structure that you would see upon collaboration with our Cure Violence Global technical assistant providers. This line chart shows the average number of case notes per participant over time. Other outputs will have their own dashboard visualizations, including number of participants, mediations, follow-up, education provided, among other activities. It also provides real-time data visualization to assist in communication and targeted improvement efforts. This data-driven approach ensures our resources are deployed with maximum efficiency and impact, focusing on areas where violence prevention efforts can make the most significant difference in our communities. Our proposed 3-year technical assistant contract with Cure Violence Global is a strategic investment in our community's safety and represents a total commitment of $161,000 over 3 years and is structured to provide comprehensive support while demonstrating fiscal responsibility. Cure Violence Global site certification is included within these costs, ensuring our program meets the highest standards of quality and effectiveness without additional expense. This carefully structured investment reflects our commitment to both program excellence and fiscal responsibility. In conclusion, this selection of Cure Violence Global as our technical assistant provider shows our continued commitment to reducing violence in Minneapolis. Their expertise brings proven track record in violence prevention programming, comprehensive training and staff development framework, a robust data collection and evaluation systems, and an evidence-based approach to program implementation. This partnership positions Minneapolis to implement the Cure Violence model, ensuring highest standards of service delivery and meaningful impact in our communities. Thank you so much. I stand ready for questions.
Thank you, Deputy Director Lake. I am looking to see folks getting queued. All right. I see a few, and I will first call on Councilmember Cashman.
Thank you, Chair Wansley, and thank you, Deputy Director Lakes, for the presentation. Just one question of clarification on the RCA. It says this is a 3-year contract with no option to exceed 3 years or extend beyond 3 years. No option to extend. So can you explain why there's no option to extend? Is that a city financial policy?
Good afternoon, council members. Councilmember Cashman. So the 3 years is the time that it takes to achieve full certification. And so that is what we have on the RCA.
Okay, for the city to achieve
Yes,
certification,
for the city.
and
Correct.
then we wouldn't. Once we achieve certification, do you anticipate that it will take 3 years to achieve? There's no way to have that happen.
Local certification, and there's also the opportunity for additional certifications for the different sites, but we're going for the local certification.
Okay, thank you. And then my second question, Deputy Director, was just about the dashboard, right? The data that I know the DID and their kind of services do have a similar database. So I'm wondering at all if it's compatible, if you know if it's compatible, so that violence interrupter groups who are hired by the city but also hired by groups like DID, is the data going to be inputted in a similar way to be collaborative, whether it's with DID or the county or the city, and interfacing with its the other data sets?
Chair Wansley, Councilmember Cashman, that's a very good question. I think the short answer is it won't be compatible like off the set. They are separate databases, and I don't know what kind of software DID is using. The longer answer is we can dump the data into in a way that we can compile the data and then pull out compatible measurements. So there are some things that we can do using software and coding to kind of make some statistical comparisons, but it would take a little bit of work and cleaning.
Okay, thanks. I'm going to ask their operations officer to send over their information to you and the team, because I think it's important, representing downtown, it's important for these systems to be working together. And obviously this is one of the sites downtown that has the most issues going on, just because of the large, groups of people being here. And then my last question was just about this dashboard as well. Will it be public, available, transparent to everyone in the public, or just available upon request?
Chair Wansley, Councilmember Cashman, we can choose what we want to do. So we can make portions of it public, we can keep portions of it private. So based off of the needs and our goals, we can play with what's public and what's private.
Okay, I'll just express that transparency and accountability is our greatest asset, our greatest tool for being a responsible government service. So I would advocate for full transparency of this for our residents, so that they can also track and monitor and educate themselves on the importance of this work. Because if they don't understand its value, then it's, if they don't understand how it works, then they can't appreciate its value as much as those who do understand how it works appreciate its value to our communities. Thank you.
Thank you, Councilmember Cashman. I also want to note for the record that Councilmember Osmond has joined us too. Next, I see Councilmember Vita.
Thank you, Chair. Thank you, Chair Wansley. Thank you so much, Director Lakes, for this presentation. I really do appreciate the direction we're going in with these grants. The level of oversight and accountability feels really good. I would go as far as saying better than I've ever felt before about these grants. So thank you so much for this this presentation. I'm wondering, though, if you can just talk a little bit about cure violence and if this is a new model, because we've always talked about cure violence and used some version of it, but why are things different now? And, like, has something shifted? Just kind of an overview of what's happened.
Chair Wansley, Councilmember Vita, I would say the model started in 2008. We've had advising with Cure Violence Global for a while. I would say with the pilot of how it started before with the Minneapolis contracts and the violence interrupters, I think there was a great beginning of starting to follow the Cure Violence model. And then I think we kind of learned more over time, and now we're ready as organizations to kind of take the next step into using these databases and to have a contract that has been written after we've had that experience, where we've learned a lot from what we're currently doing to kind of develop something more robust.
Got it. Thank you. Some of the other things are, I was looking through this and I saw a big shift in the design of staffing. So there's going to be 5 full-time interrupters. There's going to be 2, there can be up to 5 full-time, like, staff who are outside, kind of the people we see walking up and down in the neighborhoods where the problems are. 2 resource officers, I don't know the specific names of them, a supervisor, and then, of course, the person who runs the organization has a maximum of how much they could bill for themselves, too. How did that come about? Like, what was the Cure Violence model? Like, what was the discussion about how we have now transformed to being very specific on staffing?
Chair Wansley, Councilmember Vita, we have used Cure Violence Global's advice, and we have looked at their data, and they've advised us that having that standardization of the sizes is what they advise based off of the data and the studies that they've done. So we're copying that model based off of their data-driven recommendations.
And so this is some of the chart you gave us with some of the other cities, like the drop in numbers is tremendous. And so these numbers are based off of a model that, like, these cities used?
Correct.
Okay. All right. Well, that's good to know. I mean, it feels very different, but I'm on board to see what happens, right? When you think of 5, you're like, well, that's a lot different than, like, what I've previously seen, but I do understand. And can you speak a little bit more to the difference between the kind of on-the-ground interrupters and the resource officers?
Chair Wansley and Councilmember Vita, can I follow up in a response memo? I want to make sure I get the exact correct things to that question.
Absolutely. Thank you so much. And then the data, you said there's going to be one central location for data, and you mean like for all the groups that are selected here and all the groups worldwide, or you mean just like the groups here?
Chair Wansley, Councilmember Vita, all of the data is stored by Cure Violence Global. So it's a mobile application. Everyone can access it if they have on their phone, on a laptop. They will input the data, and then that data is stored by Cure Violence Global centrally. And all organizations that use this model use the same data points for collection, so we can compare across cities. We still own the data. The city of Minneapolis owns the data, so if we ever cease having a contract with Cure Violence, we'd get our data back, and we have 100% ownership of that. But it is a centralized database that they use.
Okay, so you are able to, like, share and look at trends happening in other cities and those sorts of things. Okay, my last question is, I saw that a part of the application is, I guess, community buy-in is what you could call it. Folks have to, if you're going to be deployed to a particular area, you have to get a letter from folks, organization, business. Can you just speak a little bit more about, like, the specifics in that? Because that's very different.
Chair Wansley, Councilmember Vita. So in previous RFPs, we've relied on the responders to attest to their credibility. And so with working with Cure Violence Global during the RFP process, we wanted to shift that and to ensure that the organizations that are selected do actually have credibility in their communities. And so as a part of the RFP process, We did require 3 to 5 notarized letters from organizations that have responded to the RFP.
So, like, can you give me an example of what that is? Like, who are these people that have submitted letters on their behalf?
So it has to be community members. Community organizations, persons within that community that they're attesting to having ties to.
Okay, so the applicant said, like, I prefer to work on West Broadway. And then a part of that process, I'm just using Ward 5 as an example. They said, I want to work on West Broadway. And then you said, give us 3 to 5 letters from businesses, organizations, or people in this surrounding area who can attest to knowing you, knowing that you actually do work here and have direct ties to the community.
Yes, attesting to their credibility.
Okay.
In addition to the information that they submitted about their organization, about their ties, but attestations can only go so far. We actually want to know that you're truly a credible messenger in your community.
And somebody's saying that, somebody's validating it by
Yes, so
saying
it's
what-
notarized.
Yep, okay, thank you, that's it for me.
Thanks, Councilmember Vita. I do have a few questions, but I'll actually let Councilmember Osmond go before me.
All right, thank you so much, Chair. I appreciate it. I'm not a member of this committee, but I do want to recognize on the audience, as you can see, residents of Cedar Riverside, Elliott Park, and also West Bank Business Association community members, business owners are here today. They're here because we have learned that services of violent interrupters were removed from this area. As I recalled, we had these services almost 4+ years. We have seen the change Cedar Riverside has experienced, the positive outcome that these services had in our area. And the businesses have spoken to the community meeting that I attended last Tuesday. And so my question is to what specific factors influenced Mayor Fry's administration decision to remove violent interrupters from Cedar Riverside?
Chair Wansley, Councilmember Osman, this specific presentation has to do with the advisor, the technical advisor contract. So this presentation is not about the Minneapolis interrupters, but about the advisor for the Cure Violence model.
Did I jump ahead? Is that, Chair?
Yeah, so we will have a discussion on the Minneapolis
sorry.
contracts in the next item.
I'll reserve my question for next discussion. Apologize. Thank
No
you.
problem. So getting in queue, I did have a number of questions. So looking at the RFP report, and I know on slide 13, you highlight a bit of the scope of work that Cure Violence will be providing in their role in providing technical assistance. I think you know this body has wanted a lot more data and a lot more information and more timely, and to have concrete timelines around when that would come forward to us. The last deliberations on the GBI and YGBI contracts, we were told we could not get information about that data collection. But there are some provisions in here. I'm looking on page 9 of that RFP, points 8 through 11, that does talk about the various ways in which there will be reporting. There will be some analysis done, references towards quarterly reports. But I wanted you to speak a little bit more concretely about the timelines on how NSD intends to use that program managing and evaluation and reporting that is going to be supported through this contract. For example, I know that contracts have timelines built in where contractors will have meetings or check-ins specifically with their program manager, and I know that role is still being in the hiring, or is still in the hiring phase. So I just wanted to see if you could walk us through what that will look like in a more operational sense.
Chair Wansley, council members, the contract, when it starts, It will require every single violence interrupter to be trained by Cure Violence Global on how to use the data collecting system. They will immediately have to start using it for the beginning of all of their shifts. So immediately we'll start getting that data put in, and as soon as we get the data put in, we can start seeing it on a dashboard. So almost in pseudo real time, pretty quickly, we should be able to develop those things. Some things will take a little bit longer because they also have weekly check-ins. So obviously we need to wait for a week before we get the weekly check-in data report. But the short answer is pretty quickly after we start, because they've already built the data input mechanism. We would just have to work with them. And the goal is to start with the new Minneapolis contracts on April 1st, so it should be pretty quick after that.
And looking at the quarterly reports again, look, that's on point 11 of page 9. Is there a way to get this information shared also with the body? I think that's also been a tension point too of, it's great, we know our technical assistance providers have been giving the Neighborhood Safety Department information. However, that information never matriculated to the public or to the body, so we can have a sense of there's actually some level of expertise within this department that's being utilized and how resources are being deployed within it. So want to see if there's a way to get these reports released also publicly and presentations on it of what Cure Violence is, providing you as a quarterly assessments.
Chair Wansley, absolutely. We also have a business analyst who started with us already. A part of her work will be developing those dashboards that will be online, as well as working with the council and with other stakeholders in our community to identify what data points are useful to them, what stories they want to be seeing and being told, and then working on developing that front-facing. We would like as much to be front-facing as possible and to have the public have access to the raw data so they can download it themselves and do analysis themselves if they are researchers or what have you. So we are hoping to make as much of it as makes sense publicly available.
Okay, thank you for that. And then will either Cure Violence, along with Neighborhood Safety Department staff, such as this business analyst, will you all be working to respond to some of the gaps that the New York University Policing Project report highlighted in regards to the violence interrupter services? I know one particular gap that they identify is that the times and areas in which violence interrupters were being deployed were not necessarily effective also, or just wasn't guided by actual data. So wanted to get a sense of if there's anything going on amongst staff, relationship with Cure Violence that will address that gap, along with if there's anything in the contract that prohibits the deployment of services. Because we've also heard that too from previous leadership of NSC, that there was geographic clauses that had prohibitions in the contract and that limit deployment flexibility. So those two questions. Yeah.
Chair Wansley, good question. The first question, we do have clear, good communication with Director Harrington's office to identify what areas we need to be targeting to make sure we're meeting those gaps in the report. And one of those that has been identified is that scheduling. And Cure Violence Global, they do provide that expertise to us, so they do tell us when that scheduling should happen so that we can, and they also provide us with several other pieces of support that we can look at our Safe and Thriving Communities report as well to make sure we're covering all of those gaps. Can you repeat your second part of your question?
Yeah, the
Thank
second
you.
question, in the actual contract themselves that have been provided, if there's any language around geographic clauses that limits our ability to do flexible deployments of violence interrupters, because that was listed as a barrier last time.
Chair Wansley, council members. So in the previous RFPs, the locations were specified. Vendors, once they applied to the RFP, they had to highlight the location within their proposal response that they're applying to. This time around, we made it open-ended because we wanted to use the data to determine where interrupters should be deployed. After having conversations with Cure Violence Global about whether or not the sites will change over time, the short answer is no, it will not. But as Deputy Lakes mentioned, that in terms of the hours of deployment, we'll work closely with Cure Violence Global to ensure that the times make sense.
And it sounds like you all then will be responding to some more of the gaps that the NYU report highlighted.
That is correct. And we'll make sure that the information that's listed in the contract is very clear and adapts to the model and is enforceable.
Thank you. For my next question, clerks, I'm hearing it's cold in here. I always think it's cold, even though it's nice outside. So I don't know if this is part of psychological warfare or not. But if there's any way to get someone who helps with heating and let them know to turn it up so we can be a little bit more comfortable in here. Thank you. Next question. I did actually, if you could kind of go back and spell out what actually comes with that site certification also now that we're officially in pursuit of it and have a 3-year timeline.
Chair Wansley, let me respond to that in a memo so I can get all those details for you.
Okay, I will note that as a question for that staff memo. And then also looking back on the RFP, just somewhat related to what Councilmember Osmond has raised, but I know one of the pieces of, or scope of work focuses that's highlighted in point 13 of this is that they will help support the departments in involving diverse communities. It sounds like in hiring panels to select suitable candidates and address potential termination issues. Don't know what that means. But in regards to making sure the department doesn't have a lapse of culturally responsive understanding of what's needed in certain areas, what does that look like or has looked like for the department? Has Cure Violence, prior to today's consideration of the contract, also supported you all with that?
Chair Wansley, council members, so specific to that need, they did not provide any guidance on that. The focus was really on the data, determining where interrupters would be deployed. And I think the applicable interpretation of that is more so ensuring that the interrupters go through the hiring process, especially for those that have not held a contract previously with neighborhood safety, just to ensure that they're credible messengers, that they have ties to their community. But in terms of the hiring process, it's ensuring that based on the areas that they're deployed to, they can meet the background, I suppose, of those individuals, ensure that they can communicate well, have those ties. So I think that's more so the interpretation of that than having diversity in terms of where teams would be deployed.
Okay, then following up on that, is there, I'm looking through, again, scope of focus, is there anything that addresses, because I know this has happened before, the reason why there were targeted violence interrupter services for Cedar Riverside, for instance, was when OVP initially rolled out, they recognized that crime trends there were overlooked. Same in certain parts of the city and East Village, for instance. Certain crime trends that's happening amongst our indigenous communities warrants a different response or warrants an actual interruption program. And so that's, I think, is an ongoing concern around, did we also have that type of analysis, and if Cure Violence has expertise in developing some of that?
Chair Wansley, that's a very good question. I would say specific for this contract that they would be advising on, I would say what it sounds like you're describing might be a different type of violence interruption than what the Cure Violence model recommends, if it's more targeted to anything that's outside of those recommendations of Cure Violence Global. So, for example, if you're saying that there are areas that might need a little bit of a different approach, we might be looking at a little bit of a different framework. The Cure Violence Global framework specifically is data-driven and looking at those areas where the data is showing that there's high level of violence.
Yeah, I also know they're public health driven. And because they're public health driven, not only do they use data, they also use that in complementing socioeconomic dynamics of the area where crime is being targeted. So I also am very aware because they're consulting in the inclusion of Cedar Riverside. That's why we had a violence interruption program there. So they are aware of that, of how are we making sure our violence interruption programs are culturally responsive.
Chair Wansley, I understand what you're saying now. I apologize. The Cure Violence Global is very sensitive to the cultural dynamics of different areas. I would have to get back to you in a response memo about the specific qualifications that they're looking at and their specific expertise. I know they have very good specific expertise in making sure the vendors who are selected represent those cultures and represent those districts where they're assigned. I don't know about cultural training within those districts, so I'd have to get back to you on that one.
And so staff memo on that. And then I guess that also makes me think, so what is the role that neighborhood safety department staff is playing in regards to that? Because it's great that we're relying on our TA providers to provide their subject matter expertise, but I think that's also a space where staff should be able to show up unless there's just a complete disconnect between staff and the community around like, okay, we understand you're looking at data, but we're out on the ground, we're out in communities, we're speaking with council members who are saying these are areas, these are trends that we're seeing amongst different cultural groups, like to be able to reconcile both. So I guess again, this goes back to my original question of then how staff is playing a role and using their expertise to complement the expertise of Cure Violence.
Chair Wansley, excellent question. You are correct. That is the role of NSD, to be having those conversations, to be making sure what the violence interrupters are doing is in line with the community's needs and values and the cultural needs of the different areas. There is a lot of ability for documentation and for adjustment. The staff also is making sure that we are talking to community members and that there is a good fit and that the contracts that we have with the vendors are reflective of what the community needs are in those areas.
So you're saying the role has been, NSD staff has been out across the city doing engagement with communities during the deliberations, or like to make sure they have that localized understanding of cultural dynamics.
Chair Wansley, there are NSD staff talking with council members and community members about these topics. The proposed selection of vendors was determined, or the proposed selection of areas for the Minneapolis contracts that Cure Violence advised on was data-driven, based off of incidents of violence.
No, I definitely get that point. I'm still, because I know there has been staff turnover in this department too. I'm just trying to understand where is the expertise around the programmatic details. I hear very clearly you all are on it when it comes to contracts. I think about 80% of this presentation was around the contract provisions itself. I think where we often do not see more, again, that expertise show through on NSD side is, again, those programmatic details, how you're complementing your local expertise and understanding from what you're hearing on the ground to complement the data that our technical assistance providers are providing, because they don't live here. They don't go here. You're providing, they're taking spreadsheets and making sense of it. And then you all actually are in community, and to be able to, say, yeah, data, our understanding, this influence how we're looking at administering services. So that's why I asked, if Cure Violence isn't providing that type of cultural responsive analysis, then who is to NSD, or who within NSD is giving that expertise?
Chair Wansley, that is an excellent question. Let me follow up in a response memo to that, because I think that's a very important question.
Okay. I think that is actually all. Oh, no, have one last question. So I know with GVI, YGVI, they're very explicit about the role in which that program plays in regards to law enforcement. Law enforcement is at the table. Can you spell out for the Cure Violence model and for violence interruption services, what is the relationship between that program and law enforcement? Again, going on page 9 of the RFP, the only thing that I saw was point 7 that says develop strategies to engage law enforcement for timely crime data and establish a web-based database for program activities. So would like to know, again, what that role encaptures.
Chair Wansley, another very good question. NSD staff will be working with connecting the vendors to the precincts and to the data as appropriate, as makes sense for the different areas. So each strategy for working with law enforcement will be developed specific to the different cultures of those organizations and the different needs of the different areas.
Okay. That might be one to plug in for Cure Violence. That's why I also want to know what Cure Violence perspective is on this, because I know there's a sensitive line, and we've had many conversations about this, because there is a very fine line where violence interrupters, if they're seen working very closely with law enforcement, that puts them and their credibility in jeopardy, where it's just like, are you an informant, essentially? So being very clear, because I know some of the organizations that were recommended, they do have good relationships working with law enforcement, and I think all of them do, but in a very different capacity. So just being very clear of how this model recommends that relationship being organized or coordinated. So it sounds like that's a staff memo question too, so follow up on that as well. With that said, I see Vice Chair Palmisano in queue.
Madam Chair, I don't need to ask these things. We've already had a long discussion on this. I guess I just have one, which is a follow-on from Councilmember Vita's earlier question. Thank you for the detailed description of the merits of this contract and the RFP and the selection process. When do you anticipate we'll be able to see this data that's coming?
Chair Wansley, Councilmember Palmisano, the contract should start April 1st. It will take a little bit of time to train staff and to get them to start using it. So mid-May, we should start to see some data, and then we can probably, by this summer, expect to see some public-facing options.
Thank you. And then I would imagine that data would get better over time as we have more of it. I'll just end with this question. You've touched around the edges of this, like, a lot, but I'm just curious. I'm wondering what exactly we will need to do still to receive that formal certification as a Cure Violence site. And I believe the chair asked a very similar question, but do you have a general sense of, like, here are the things we still need to do, and this is the kind of lift it's going to take?
Chair Wansley and Councilmember Palmisano, I don't have all the details for that, and not even on a vague level, so I would have to get back to you in the response memo. Yeah.
I just thought, like, on a high level, we think it'll be 6 months but that's all right. I'll read through all the gory details to learn and find out. Thank you.
Thank you, Vice Chair. I see Councilmember Ellison in queue.
Thank you, Madam Chair. Not so much a question, but I do want to thank you for the presentation. This is super helpful for us to understand kind of where we're going. I know that from the dais, it's kind of felt like we're not sure where we're going, and so this adds a little bit more certainty to that. I did want to. I don't so much have a question. Maybe I'll find one, but there's a few things that I feel like a little bit of a broken record, but I'll just kind of keep saying, is that. We do continue to have conversations about the ways in which we're holding providers sort of like accountable, which I think is sort of a given that has to happen in every service delivery situation. But I feel like I really want to make sure that we get to a place where we're learning the ways in which the department and us are making sure that our service providers are supported. Because if folks just kind of feel watched, if they feel like we don't trust them. You know, I'm going to start, I feel like that leads to an erosion of trust, and bad, you know, it leads to bad work. It leads to low morale. And so those are things that I'm concerned about. And data is important. And again, another one of those things that's a given. But, you know, to Councilmember Wansley's point, the data itself, in and of itself, does not save any lives, right? I see Ms. Connie in the crowd. I'm going to use you as an example because I see you out there. It's good to see you. Ms. Connie might save a life out there on the street, right? Somebody on her team might do that. And I think that to me, I want to know what someone like Ms. Connie thinks about the platforms that we're asking her and her team to use. I want to know what scenarios they find themselves in, because I want to know, and I know transparency is important, critically important, but if we're in a situation where there's a young person or somebody being intervened on the street, they find themselves in a situation where they want to get rid of a weapon. They want to get their weapon off the street. And they want somebody in Ms. Connie's team to help them do that. They're going to be less likely to do that if they feel like, or they suspect that they're going to be subject to now police investigations. And now, all of a sudden, they keep that gun in their possession. They're less likely to come forward. They're less likely to engage with this service, even if they're scared and even if they want to. You know, certain things are given, right? We know that if a gun's in our possession, it's going to go through NIBIN and it's going to do all those things. But if somebody knows that, like, okay, every single time I talk to them, there's going to be a log of my interaction, and how protected is that log, and how will people on the street see that interpreted if they ever see that, right? Am I going to be seen as a snitch? I think that these things are critically important because the service is to make sure that we can get guns off the street, that we can interrupt cycles of violence. I get worried about the ways in which we've and this proceeds. This has been happening with violence prevention for a while now. I think that we have sort of been demanding a lot of just sort of this busy work, right? And I think that if you demand busy work, you're going to get sort of just shallow results. You're going to get shallow data. But if you value the substance of that work, then you're going to get substance in return. And so I struggle to know what the balance of that is, but I know that, like, on the ear test, it feels like we talk a lot about the busy work and handling that, and less about how we're supporting and making sure that our providers are lending us their expertise just as much as we're holding them accountable to their time and their activities. And so I'm just going to kind of leave it at that. There's not really a question in that, but I feel like it's important to say. And the last thing I will say is I think that there also needs to be some capacity in which this kind of information is delivered to the council, like not always just on the dais. Like, I would love to be a part of a study session, have some of our providers in the room kind of giving us anecdotal stories, helping us understand like how they're interfacing with the data. Would love to hear from you and your team to ask all of like the questions that might be a little bit tedious, to give some inputs into specific corners that might not be registering as we look at as we're looking at overall data or broad data. I think it's really important. That way we come into committee with less confusion and angst, and more with like, okay, we understand where we're all moving together. So I don't know if my colleagues would be interested in that, but I certainly would be interested in those kinds of like less structured, less performance-based, conversations. So.
Oh, no, sorry, Ms. Connie, no, no public comment.
Those are questions for staff, but,
Yes.
but I do love your input, though, so.
Thank you, Councilmember Ellison. In the Public Health and Safety Committee, we did do a convening last August around this. So would love to work with Deputy Director Lakes and my colleagues, and then Chair PHS Chair Chavez to see how we could do a roundtable discussion and do like we did last year where we had the providers come and lend their expertise, so it was more listening, like you highlighted. And yeah, I'm more than happy to collaborate in making that happen. So that said, I do see Councilmember Vitaw in queue.
Thank you, Chair Wansley. Thank you to Councilmember Ellison. I think you brought up some good concerns, but I think when I look at the data that they've shown, like the reduction in that, they figured it out somehow. And I think we have to have those conversations, not necessarily on the dais. I think there's a lot of things that go on in this work that shouldn't be in the presentation that Cure Violence could probably tell us happens. And that's how you see that huge reduction in violence. And it may not be captured on the app, but there's other there's other ways that folks are capturing it. I have one question, though. I wanted to know how often you're meeting with Cure Violence. Like, how often are you meeting with them right now to kind of come up with this plan, and how often do you anticipate meeting for this 3-year contract?
Chair Wansley, Councilmember Vitaw. So once we started drafting the RFP, the meetings were on an ad hoc basis, and RFP meaning for the Minneapolis strategic outreach for the selection of vendors for the next iteration of contracts. During this negotiation process where we want to ensure that the contracts align with the model, we've been meeting with Cure Violence Global once a week since, I want to say sometime in January of that sort, and they've been really, really helpful throughout the process because we do have a lot of questions and we want to ensure that we follow the model to fidelity. And so moving forward, we have a designated individual that will be working with the department and the vendors, Q, and he's available with as needed, but also based on the timeline that is provided in the Cure Violence Global budget table, which I'm happy to provide afterwards.
Yeah, that budget table would be great. I'm also, I guess I'm maybe asking if we foresee like changes in this contract amount, or do we really think that this amount is going to cover the time we need for these services over the next few years?
So there should be no changes in the contract amount unless there's an increase in site visits or services. But based on what is outlined in the RFP, we were very explicit that we wanted the cost for a 3-year period in order to make it competitive, to have an understanding of what our costs will be up front.
Thank you.
Thank you, Councilmember Vitaw. I see Council Vice President. No, you took yourself out. Okay. All right. I did just have a quick follow-up too, in regards to Cure Violence recommendations, because this has come up as we're talking about considering the interrupter contract separately too. But what is their approach? Let's say, the data shows the services are working, and I get you have a certain or limited pool of resources, and then you remove that contract, and then you see a spike. So what is their recommendations around just even service maintenance? Because I think that also undermines the basis of the model. It's like, yes, we want to stabilize, and not just have spikes because you got something good here, then move somewhere else. So just want to also get a sense of what their recommendations were on that.
Chair Wansley, that's an excellent question and an age-old public health question where something is working and then we take resources away and then there are spikes. Cure Violence Global has been very clear that that is dangerous, and they do not recommend always taking away resources where things are working. It is a hard balance when you have limited resources and trying to figure out the best case of what to do with them. I think they would, I think just that is a hard thing. And they are very cognizant of that risk. They're also very cognizant and have advised us when we do put in violence interrupters in areas where they weren't before to be really paying attention to where things spread away from there and making sure we're being very careful about keeping our surveillance responsive to those different things. So.
Okay. Thank you. Next, I see Councilmember Cashman.
Thank you, Chair Wansley. I just wanted to confirm that you had asked for a staff memo follow-up on the question of which staff in the Neighborhood Safety Department will be providing to be responsive to the vendors and also to cure violence, right? Like that interface?
Culturally responsive. I raise culturally responsive.
Okay. So if I could just add a question then, this is, because I know that there is a vacant position, right, in NSD that will be the program manager. So I would like to be reminded, if you know now or in staff memo, what the hiring date is and the plan for hiring that position, because I think it's important that we have someone on staff who's prepared to be this interface between the technical assistance provider and the vendors on the ground.
Chair Wansley, Councilmember Cashman, I can tell you that we are doing interviews for that Thursday and Friday of this week, but if you want to put it in the memo, I can give you a higher date once I get that.
Sure, that'd be great just to have that hiring date in writing so we can also be sure that everybody's aware that that position is in the process of being filled. Yeah, so with that, I guess I'll move to approve this and send this to the full council next week.
There's been a motion to approve these items. I will second that. So with that, I will ask the clerks to do a roll call vote. Oh, and before you count, thank you, Deputy Lakes, also for your presentation.
Councilmember Vito.
Aye.
Ellison.
Aye.
Cashman.
Aye.
Chugtai.
Aye.
Vice Chair Palmisano.
Aye.
And Chair Wansley.
Aye.
There are 6 ayes.
All right, so that motion carries. Next up, we have discussion item 23, which is the contracts with multiple organizations for 2025 Minneapolis services. It is my understanding, based off of an email from the Office of Community Safety staff this morning, that they would like this item to be pulled with the goal of resubmitting it to COW, or also known as the Committee of the Whole, for council's consideration, and that would take place on March 25th. That's a Tuesday. So that said, I will invite Jared Jeffries from the Office of Community Safety to come up and speak more to this item and request.
Good afternoon, Chair Wansley, Vice Chair Palmisano, and council members. I am Jared Jeffries. I am the Chief of Staff for the Office of Community Safety. I'm here to speak briefly about the request from the Office of Community Safety to withdraw the 2025 Minneapolis Strategic Outreach Initiative contracts from today's AEO agenda. We are requesting that RCA at this meeting be pulled so that we can submit an RCA for the March 25th Committee of the Whole meeting, as Chair Wansley said, with the top 5 scoring proposals. This would not include the 6th scoring contract originally in the RCA, Salem, Inc. We are requesting this because we want to move forward the top 5 scoring proposals at the Committee of the Whole this cycle to ensure no gap in service. We are reviewing events that have occurred since the RFP scoring, so we will not be requesting approval for Salem, Inc. at Committee of the Whole on March 25th. I can't say more or answer questions at this time, as the data is non-public. There will be a detailed presentation on the RFP and top 5 contracts at the March 25th Committee of the Whole meeting. Thank you for your time to address this topic.
Thank you, Jared Jeffries. I do know first that Councilmember Osmond, you had intended to speak to this item, so, but yeah,
Yes.
refer to you.
Thank you so much, and anyone can answer this question. As I recognize again, residents of Cedar Riverside, Elliott Park, and the business community at the West Bank are here at the attendance. We have learned recently that violent interrupters was removed from Cedar Riverside. About 4.5 years ago, we were able to bring this services here, and they have been actively working at the community. We have seen the change. We have seen the data. We have seen great things from local inspectors, the chief, and everyone talking about, especially the most important thing, the community businesses, the important effect it had in the community having the services. So my question is, what specific factors influence it, mayor's administration, to remove these services from violent interrupters from Cedar Riverside? That's my first question.
Chair Wansley, Councilmember Osmond, I cannot answer that question today, but a lot of that information will be provided at the March 25th Committee of the Whole meeting.
Or is Deputy Director Lear Lakes also is still
Is here.
here? And they just presented on that, so I don't know if we can also invite in case they would like to share.
I'm welcome, Director Lakes, come up, but my understanding is that we were prepared to present on this at the March 25th Committee of the Whole meeting.
Well, the community don't have a time to wait around. They're sitting right here. They want to know why Cedar Riverside, the programs are being removed. I have met Director Lakes in private meeting, and I would like that questions to be answered publicly. Thank you.
Yeah, Director Lakes, yeah. Yep.
Chair Wansley, Councilmember Osmond, thank you for the question. The Minneapolis contract, which will be talked about at the next Committee of the Whole, used Cure Violence Global's expertise to identify 8 zones for interrupter services to be held in. They used 5 years of violence data, which I can speak more to in more detail, but that was how they developed those 8 regions.
And does that mean this specific region is that we're talking about the West Bank, see the Riverside area? Is it showing there's less violence, that we don't need the program?
Chair Wansley, Councilmember Osmond, it indicates that it is not the top 8 areas of violence.
Do we know how, well, I know how this program has helped the crimes come down ever since 2020 or 2021, and this program has worked. So does it really make sense for Cure Violence or the administration to make a decision to remove what's working?
Chair Wansley, Councilmember Osmond, it is about the data that we do have and the resources that we have to meet the needs.
I'm sorry, is it the resources or the data? Which one is it?
The data suggests we have 8 zones, and the resources that we have include being able to fill 6 of those 8 zones. If there were more resources, maybe we could expand more zones, but the reason that those 8 areas were chosen was not because Cedar Riverside doesn't need those services and that those services aren't helpful, but they weren't the top 8 areas based off of the resources that we have.
Thank you. I believe it's a common sense why they are not top 8, because the program that existed 4.5 years has worked. We have seen it. We have heard from the community. We're supposed to be embracing and keeping what's working, not reversing and redoing the great work we have accomplished. So I see that as just, in my opinion, a failure from the administration to focus what's working, not just going what the data is, but also what's working, interviewing business community, talking to the resident that says, yes, this program has worked. And in my opinion, it shows lack of disconnect from the community, lack of not listening to the council members that represent the area, that's saying, it's a wonderful, we finally brought this program. There was a reason we brought this program, if you go back. We had violence in this area. We had overdoses. We had epidemic before the epidemic. Let's just say that that's how Cedar Riverside continue to phrase in that area. So I don't know I can't imagine what kind of impact it will have removing this violent interrupters from Cedar Riverside. And I would think you can go back and answer to the community and really make a sense that we're removing something that worked. I'm hoping that we can find some kind of ground before the 25 to resume the services back to the Riverside, because if you don't, in my imagine that we're going to go back how things were about 4.5 years ago. It's just a common sense. One last point that I want to make is that now we know that Cedar Riverside is no longer going to be having the services. Also, could you please talk about specific neighborhood organizations like Elliott Park and Stevens Square, and what the statuses are those neighborhood? Will they be, do they include those 8 section of the cities? Will they be having services? I would like to know that, and residents that are here would like to know that, and that will be my questions. Thank you so much.
Chair Wansley, Councilmember Osman, I don't know off the top of my head if that is one of the 8. Let me get back to you.
Appreciate it.
Sounds like also a staff memo question then. Yeah, ahead of that. Thank you, Councilmember Osman. I have a couple of questions too. So starting, Jared Jeffries, you mentioned the request to pull this item, which I'll make the motion after discussion, is related to you all evaluating between the RFP scoring timeline and now, I think you said, can you restate that piece?
Yes, we are reviewing events that have occurred since the RFP scoring, so we will not be requesting approval for Salem Inc. at Committee of the Whole on March 25th.
Okay, and the RFP scoring happened a while back, correct?
Correct.
Okay, the reason why I'm asking is because I know a number of us raised concerns about this contract all last week, or definitely on Friday when it became public. And we were informed in emails with the commissioner that you all were proceeding with the contract. So that does seem a little bit weird of like between Friday and now, that there's now this request to pull when it seems like you all were very certain. So I just wanted to get a sense, like you named a much broader timeline, but did something shift between 2 days ago and now?
Chair Wansley, I'll have to stick to my original statement. I can't say much more than that.
Okay. And then for the 6th contract that you're looking to basically not bring forward, can you share what is going to happen with that? I know at least with our rescue, there was a re-solicitation process. As it's been highlighted, people want to see these resources out on the streets. So what will happen with this contract now?
Chair Wansley, again, I'll have to unfortunately stick to my statement over reviewing the events since the RFP.
Okay, so we have no understanding of what will happen with the 6th contract or a process for that. And then actually, Deputy Leah Lakes, I did have a follow-up based off of a response that you named. So in light of just the resource questioning, because this also came up during our deliberations around GBI and why GBI, have you all finalized your budgets around the community trauma response funding and the violence prevention funding? I think this was a question that also came up during that deliberations around, again, how are you all using data to really assess programmatically what is warranted resources based off of safety trends or crime trends, and it seems that, like how did you relate resource allocation around Minneapolis to these other outstanding programs that I don't also recall having a line budget item, but I'm assuming also you will be taking into consideration in the very near future.
Chair Wansley, that's a good question. I need to follow up in a response memo to get all the details. But I'm also very happy to have more in-depth conversations around the budget that we do have at any time.
Yeah, I think it would be helpful, again, just knowing how is budget, I mean, that's been an outstanding question around, like, with GVI, why GVI, seeing resources were needed there, absolutely. And same here, and thinking through if there's hard decisions being made around, like, okay, are there some other programs to really help where we're seeing, by limited data, where we're seeing some really good outcomes? Because from my understanding, some of those other services, we're still in a very early process of even gathering data around how effective or programmatic outcomes are tied to the community trauma response funding and the violence prevention funding. So, yeah, that would be a staff memo follow-up question too. And then I do see Councilmember Vita in queue.
Thank you, Chair Wansley. I have a question for you too, Deputy Director, because you keep saying that we could have, I guess you're explaining to me if it's wrong, but it sounds like you're saying Cure Violence selected more than we were able to select due to budget cuts to the department.
Chair Wansley, Councilmember Vita, we had a reduced budget from last time. We are 50% less than we were last year. And we have a lot of earmarks and we have a lot of contracts. So a lot of the money that we have budgeted is kind of already accounted for. It's already spoken for. And the money that we put towards the Minneapolis contracts for those 8 sites, we have 2 alternative sites, but that we have funding for 6 sites.
Right, okay, I understand. Due to budget cuts, you dropped 2. And if you had 50% more than like what you had last year, you probably could have gotten all 8 is what it sounds like to me. So thank you for that. Mr. Jeffries, are you going to be able to talk to us on the 25th about what is going on here? I'm extremely concerned about this particular contract. As Councilmember Wansley said, there's been a lot of stuff going on in the media over the weekend about this particular contract. I'm concerned that it's being pulled, and we're not saying why it's being pulled. I've gotten so many questions about this particular contract, especially because this month there's been a lot going on with this group, and so I'm asking, are you going to be able to share why this is being moved? Is it coming back? I mean, you kind of haven't given an answer of like it's going away forever. You just said in light of something, it won't be on the agenda next week. So like, what am I to expect moving forward about this contract?
Chair Wansley, Councilmember Vita, the short answer I can give you is I'm not sure to all of those questions.
Thank you.
Okay. That said, I will make the motion to refer item 23 back to staff. If I can have a second.
Second.
Okay, with that, I don't see any additional discussion. We can take a roll call vote on that.
Councilmember Vita.
No.
Ellison.
Aye.
Cashman.
Aye.
Chugtai.
Aye.
Palmisano.
No.
And Chair Wansley.
Aye.
There are 4 ayes and 2 nays.
Okay, so that motion carries, and that item has been referred back to staff. Next, we do have item 24, which is going to be added just for the public awareness as an addendum. But this is a closed session that council will be receiving, or sorry, committee members will be receiving as well, on the briefing on strategies related to labor negotiations involving the Police Officers Federation. So before I move to close that meeting, I will recognize the city attorney to provide the legal basis and more information regarding the requested closed session.
Thank you, Chair Wansley. The next item on the agenda is receiving a briefing on strategy for labor negotiations involving the Police Officers Federation. Consideration of negotiation strategies or discussion and review of labor negotiation proposals may be held in a closed session pursuant to Minnesota statutes, section 13D.03. In order to close the meeting to the public, a majority of the committee must vote to close the meeting. In deciding whether to close a meeting for labor negotiation strategy, the committee should weigh the right of the public to know what its government is doing against the need of the city to reserve the confidentiality of its labor negotiation strategy.
Thank you, City Attorney. I will now move that our public meeting be closed as authorized under the provisions of the open meeting law, specifically Minnesota statute section 13D.03, for the purpose of receiving a briefing on the strategy for labor negotiations involving the Police Officers Federation. With that, may I have a second to that motion?
Second.
All right, I will do a roll call vote.
Councilmember Vito,
Aye.
Ellison,
Aye.
Cashman,
Aye.
Chugtai,
Aye.
Vice Chair Palmisano,
Aye.
and Chair Wansley.
Aye.
There are 6 ayes.
All right, that motion carries. And we will close the public portion of our meeting and convene in closed session. I will note for colleagues, we will get started, I want to say 3:48, just to give space for other colleagues to join us and meet us up here. And then for the viewing public, I will note that the broadcast of this meeting will continue, and the Administration and Enterprise Oversight Committee will reconvene in public after we have concluded in closed session. So with that, thank you. All right, tech team, 1 minute warning. All right, so we're convening. The time is now 4:11, and the Administration and Enterprise Oversight Committee has reconvened in open session following our closed session. So with that, I will ask the clerk to call the roll to prove that there is a presence of a quorum.
Councilmember Vita,
Present.
Ellison,
Here.
Cashman,
Present.
Chugtai,
Present?
Vice Chair Pomazano,
Present.
and Chair Wansley.
Present. Let the record reflect that we do have a quorum. With that, we have concluded all business to come before the committee today, and there's no objections. We are adjourned.